Hi, my name is Cassie and I'm a paramedic for Austin Travis County Emergency Medical Services. Austin Travis County EMS paramedics are not just ambulance drivers and not just EMTs. One of the most important things about us is that we are a third service. We're not part of the fire department, nor are we part of the police department. Being a third service allows us to focus on the most important thing, and that's our patients. Every year we receive over 110,000 911 calls. Our job is really kind of a combination of not just kind of those critical calls that you see on TV, but also of public health calls, just being there for people who need to have some additional help. Paramedics go through an intensive, approximately 2-year training process to even begin the job. As part of that training process, you go through about a 500-hour field internship where you're on an ambulance learning from a field training officer. After that, you also go ahead and you do training in operating room, cardiology, and different interventions that we can do to really help our patients. In some cases, such as in cardiac arrest, we can do almost everything for your family member that they can do in the emergency department. We carry the same type of cardiac monitor. We can give you an IV and give you drugs in that IV to help your heart. We can also go through and put a breathing tube in your throat if necessary to help you breathe. The state requires 144 hours of continuing education every 4 years to maintain our paramedic license. Our department believes so strongly that continuing education is important that we provide almost double that amount. Every year, our 110,000 EMS calls run the spectrum from those major traumas and cardiac arrests that you hear about to ones that are a little bit more simple. For example, someone who might need a welfare check or someone who needs just kind of a psychological evaluation. Most of our calls are not those acute calls that you hear about, the traumas and the cardiac arrests. The vast majority of our calls are people who, for example, are suffering from flu-like symptoms, have broken bones, scrapes, and need a ride to the hospital. When a medical call comes into our 911 call center, you're going to be talking to a communications medic who's going to be asking you a detailed list of questions about the situation that's going on. Depending on how you answer those questions, they'll be giving you a detailed list of things that you can do to help your family member or yourself until help arrives. Calls are based on 5 different priorities, 1 through 5. Priorities 1 through 4 are going to be responded to with lights and sirens by the ambulance because the call taker has identified some type of possible life threat. Priority 5 calls are calls where there's no immediate life threat that's been identified. For priority 1 through 3 calls, you might see some additional people show up on those scenes. Those are going to be our first responders or firefighters who are there to provide additional help to us paramedics while we're taking care of you. When paramedics arrive, we're going to ask you a very detailed list of questions. We're going to ask you about your past medical history, any allergies to medications that you might have, medications that you take, who your primary care medical doctor is, and what events have led up to the injury today. All of these questions allow us to help diagnose what's going on and to begin that treatment on the scene before we're even back in our ambulance or before we're even started to the hospital. Remember, we are paramedics and medical professionals. Every situation is unique, and we are able to respond with the best training in order to bring that emergency room to you. Thank you very much for the opportunity to talk to you about what it is that we do. Without your support, it wouldn't be possible.